Assalamu alaikum everyone. My name is AL-MASUM. My ID is 12115022. Today I am thrilled to be here to discuss about the chemotherapy of parasites. I believe this topic is crucial because to understand the pharmacology. I hope this presentation will provide you with valuable insights and spark some interesting discussion. Here is the table of contents. Let's dive into it. At first, we discuss about the helminthiasis and the drug used in helminthiasis. And anthelmintics are drugs that either kill or expel infesting helminthes. Anthelmintic infection, also known as helminthiasis, is caused by parasitic worms. These worms can live in various parts of the body, including the intestines, lungs, liver, and also blood. There are many different types of parasitic worm, each with its own unique and characteristics and transmission method. Anthelmintics are used for treating infection caused by roundworm, pinworm, hookworm, liver fluke, etc. Here we see the picture of uh, some helminths. Here we see the classification of anthelmintics drugs. For roundworm, hookworm, or pinworm, the albendazole and mebendazole are used. For whipworm, Tricera spiralis, albendazole and mebendazole are used. For threadworm, ivermectin, albendazole are used. For filariasis, diethylcarbamazine, and for tapeworms, nicotinamide, or for hydatid disease, albendazole are used. They kill parasites. This type of drugs are kill parasites by binding to nerves and muscle cells and causing paralysis and eventually death of the parasite, blocking the transport of glucose by the cells and thus causing paralysis of the parasite, inhibiting the formation of young worm from the adult worm. The is common used drugs. Because albendazole is a broad spectrum anthelmintic. Albendazole methyl 1-hydrogen benzoyl carbamate is made by heterocyclization of a derivative of phenyldiamine to derivative of benzimidazole. The mechanism action of albendazole is bind to colchicine site of beta tubulin, inhibits its polymerization, assembly of microtubules, cell division, impaired uptake of glucose, glycose in store depleted, decreased production of ATP, and also alteration in tegument and intestinal cells or on death of the parasite. Mainly, it blocks the glucose uptake or glucose store depleted. The use of albendazole is giardiasis, trichuriasis, neurostichiasis, filariasis, pinworm disease, hydatid disease. It is the albendazole is not given in pregnant women for patients who have benzimidazole hypersensitivity history. Drug interaction: if albendazole co-administered with praziquantel, albendazole activity is more effective due to different mechanism of action. The pharmacokinetics we see in the table. The route is if oral, the onset is very slow. Peak concentration given in 2 to 4 hours. The duration of action normal in action. Half-life is 2.5 to 9 hours. Metabolism in the liver organ. The excretion site is colon or feces. Here we see the choice of drugs for helminthitis. Here we in table we see the worm first choice of drugs and its alternative drugs. Now we discuss about the anti-malarial drugs. These are drugs used for prophylaxis, treatment and prevention of relapses of malaria. Malaria caused by 4 species of protozoal parasites Plasmodium is endemic is most part of India and other tropical countries. The WHO estimates that the actual number of malaria cases in India is much higher, and an expert committee has estimated that about 40,000 malaria deaths occur annually, transmitted through bites of infected Anopheles mosquitoes. Objective and use of anti-malarial drugs. The aims of using drugs in relation to malarial infections are to prevent a clinical attack of malaria, which is prophylactic to treat clinical attack of malaria, to completely eradicate the parasite from the patient's body, to countdown human to mosquito transmission, which is gametocidal. The classification of drugs are five types. The tissue scissontosite, which is used the sulfonamides, pyrimethamine, etc. drugs. Second, hyponojoeticides. This is the primaquine and tafenaquine drugs are used in this situation. Blood scissontosides is the type 1 and type 2. Type 1 is quick onset and which is chloroquine, mefloquine, quinine, etc. Type 2 slow onset, pyrimethamine, sulfonamides, etc. Here are the treatment of uncomplicated malaria. A is Vivex or malaria. Chloroquine 600 mg followed by third and 300 mg after 8 hours and then for next 2 days. In occasional case of chloroquine resistance, quinine 600 mg for 8 hourly into 7 days. Doxycycline 100 mg daily and also 7 days. It continues for 7 days. Chloroquine sensitive falciparum malaria. Chloroquine and primaquine single dose are used. The, the treatment of severe and complicated falciparum malaria, artesunate, artemether, artethar, quinine dihydrochloride, etc. are used. The amoebiasis is also known as amoebic dysentery, is a disease caused by the protozoan parasite Entamoeba histolytica etc. This parasite primarily infects the human bowel but can also affect other organs, most commonly the liver. Here are the symptoms or more severe cases, causes and diagnosis of amoebiasis are described in this slide. The anti-amoebic drugs are useful in the infection caused by anaerobic protozoa, Entamoeba histolytica, and other Entamoeba species are generally non-pathogen. Classification of drugs: two types of drugs: tissue amoebicides, luminal amoebicides, etc. The most common amoebiasis drugs are used in amoebiasis is metronidazole. Metronidazole is used to treat bacterial infection in different areas of the body. It is also used to treat infection caused by protozoa and infection caused by bacteria that do not need oxygen to survive. Here are the side effects, contraindication, and interaction of the metronidazole drugs. Thank you for listening me.